What are adenomas found during a colonoscopy? Imagine discovering small growths inside your colon that could potentially turn into something more serious if left unchecked. During a colonoscopy, doctors often find these growths called adenomas. They are a type of polyp, which is an abnormal tissue growth on the inner lining of the colon or rectum. While most adenomas are benign, they are considered precancerous, meaning they have the potential to develop into colorectal cancer over time if not removed. Adenomas are made up of glandular tissue that looks similar to the normal lining of the colon. However, under a microscope, they show abnormal changes called dysplasia. Dysplasia indicates that the cells are not normal and could become cancerous if they continue to grow unchecked. The key to preventing colorectal cancer is identifying and removing these adenomas early. There are different types of adenomas based on how they grow. The most common are tubular adenomas, which are usually small and made mostly of tube-shaped glands. These tend to have the lowest risk of becoming cancerous but still need removal. Villous adenomas are larger and have finger-like or leaf-like projections. They carry a higher risk of turning into cancer compared to tubular adenomas. Then there are tubulovillous adenomas, which have features of both types and an intermediate risk. Adenomas can also be classified by their shape. Sessile adenomas are flat and broad-based, making them harder to spot and remove. Pedunculated adenomas grow on a stalk, making them easier to identify and snare during the procedure. The risk of an adenoma containing cancer cells increases with its size and villous features. For example, villous adenomas have a 15 to 40% chance of harboring cancer cells, especially if they are larger than 1.5 centimeters. Tubular adenomas, especially those smaller than this, have a much lower risk, around 2%. Most adenomas do not cause symptoms, which is why regular colonoscopy screenings are so important. These screenings are designed to catch adenomas early before they can develop into cancer. When adenomas are found during a colonoscopy, they are usually removed right then and there to prevent progression. The number, size, and type of adenomas found help determine how soon the next screening should be scheduled. In summary, adenomas found during a colonoscopy are precancerous growths that, if left untreated, could develop into colorectal cancer. Removing them promptly is a key part of colon health and cancer prevention. Regular screening and early removal of adenomas can significantly reduce the risk of developing colorectal cancer later in life. Always consult with your healthcare provider for personalized advice and follow-up plans based on your specific risk factors and health history.